Hello, this is Dr. Grande. Today's question asks if I can analyze the mental health and personality factors behind people who refuse to wear a mask in areas where it is mandated by law. Just a reminder, I'm not diagnosing anybody in this video, only speculating about what could be happening in a situation like this. If you enjoyed this video, please like it, subscribe to my channel, and consider supporting me on Patreon. I'll put the link to Patreon in the description for this video. So first I'll start by talking about the science behind makeshift masks. We really see a limited amount of research here, which of course puts us in a situation where we don't really know what the best course of action is. There appears to be some benefit to using a makeshift mask in terms of avoiding the transmission of infectious respiratory illnesses, but it seems clear they are not as effective as traditional masks, like an N95 mask. Now, one could look at this situation and think this is really more about the precautionary principle than actually preventing the transmission of illnesses, like guaranteeing the prevention. For example, somebody could look at the masks and say, there's no harm in trying this, therefore we should try it. So we don't have evidence that clearly says these makeshift masks work, but they might work, therefore it's worth the inconvenience. Now, I've heard some people compare this strategy to getting into an automobile and tapping on the steering wheel before you drive. So if you do that, and you do it consistently for, say, 10 years, and you don't have an accident, does that mean that tapping on the steering wheel helped you avoid the accident? And does that really apply to makeshift masks? Well, the difference here with this comparison is that there's no logical or theoretical reason that tapping on a steering wheel would increase somebody's chances of being safe from a car accident. With masks, there is some reason to believe they may be helpful. They could help people in avoiding respiratory droplets, which contain the virus. Now, there have been many reasons put out there why wearing a mask may not be a good idea. The limited evidence that they're effective that I've talked about, but also there are other theories, like people are unlikely to wear masks properly or consistently. Wearing a mask might actually make people feel safe, and therefore they would avoid other preventive tactics like social distancing. We also see a few other theories about masks causing glasses to fog up, so they could cause trouble when driving. And of course, people could touch their face when they're messing with the mask, and that could lead to transmission of COVID-19. All these are actually good points, so we do see this is a tough situation. There's really no easy answer as to whether people should or should not wear masks. So putting the science aside for a moment, I think this debate is really about following the rules. In areas where they have been mandated, society has made a decision that wearing a mask is appropriate, and that's where we get into the mental health and personality factors of people who refuse to follow those rules. Now, there are a few versions of people who don't follow these rules. It's not always as simple to say it's someone who wears a mask or someone who doesn't. It's not always clear between those two categories. For example, we see people who don't own a mask. So clearly, they seem to be refusing to cooperate with any of these rules. They don't have a mask, so therefore they can't wear one. We see people who wear it sometimes, so their compliance is not 100%, but they understand they need to follow the rules at least once in a while. We see people who wear masks incorrectly. I see this all the time. So they're wearing a mask like down under their chin. It's not even covering their mouth or their nose. I don't really consider that compliance. I think sometimes they know that's not the correct way to wear the mask. I'm pretty sure they know that a lot of the time. And then we see people who wear something that is clearly not a mask. I've seen this many times too. Like a paper cup with holes in it, with like a rubber band to hold it around their head, or a large plastic water bottle. This is my favorite. Kind of looks like IG-11 from The Mandalorian. So again, it's not always clear. But just to simplify this a bit, I'm going to divide people into those who comply and those who don't. I realize there's a gray area in the middle, to be sure. So here are the reasons why people do not comply. They could believe that masks cause more harm than good. Again, transmitting the illness by touching their face while they're trying to adjust the mask, the fogged glasses when driving I talked about. Now, some might say, why don't they just take the masks off in the car? Which I think makes sense, but again, it goes back to the idea that somebody could touch their face. So this can get kind of tricky. Next reason, they don't believe that COVID-19 is dangerous. So this would include a number of conspiracy theorists They think that this is just all made up and nobody's really dying of this illness. The next item, they know that they are not infected. So masks don't really offer much protection for an individual wearing them, but rather they provide protection to other people from the person who is wearing the mask. So if somebody believes that they are not infected, they may not believe that wearing a mask is important. The next item, sometimes people are just rebellious, especially with a new rule. So coronavirus led to this mask rule, and some people are simply going to rebel against the rule. It could be that some of these individuals are narcissistic. So I shouldn't have to do something for society. What has society done for me? I'm too important to wear a mask. All the different things we see with narcissism. It could be that they heard something different initially, and this has caused confusion. And I think this is a legitimate concern. On March 20, 2020, in the United States, we see the Centers for Disease Control and Prevention said they do not recommend people wearing masks. On April 4, the advice changes. This makes people wonder if the authorities really know what they're doing. Releasing this statement, telling people not to wear a mask, was a mistake. They didn't know whether masks would work or not, yet they committed to one direction. So as we can see, it's more complex than people simply being antagonistic. There are many reasons why people won't comply with the rules on masks, which means there are many different personality profiles associated with this behavior. If I were to focus on reasons like being narcissistic, rebellious, and having conspiratorial thinking, then this would be the personality profile of a person who does not comply. I'll use the 5-factor model here. I remember the 5 factors through the acronym OCEAN: openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. So here we would expect to see a low level of openness to experience. People low in this trait don't believe in theories. And wearing a mask, right now at least, is largely based on a theory. We see low conscientiousness. It could just be that people are being irresponsible. We see a mid to high level of extroversion. Somebody is assertive and dominant. They want others to know that they are simply not going to follow these rules. Agreeableness would be low. We see a low amount of trust, altruism, and empathy. And we would expect to see a mid to high level of neuroticism. These people are reacting emotionally. They're being told to do something, and they feel like it's not fair, so they're acting out. So again, for some, they could be reacting to their emotions. The bottom line is that masks should be worn, if nothing else, as a gesture to society that someone is trying to mitigate risk. There is a lack of empirical support for their effectiveness, but we know that it causes discomfort to people when they see others not wearing masks. This is, in some sense, maybe an illusion. They see people with masks and they think, okay, society cares, right? When clearly, I don't think society does care that much about what's going on with COVID. At least a substantial proportion doesn't seem to. It was taken seriously in the beginning, but now I think people are just bored with it, which is an anti-science perspective because it's still just as deadly as it's ever been. But this is how people often react to stressors like this. If they don't see it directly affecting them, especially after a few months, the level of fear simply drops. So I think that actually explains a lot of what's going on as well. With the human condition, sometimes there's simply a limit to how long people will worry about something, no matter what the risk. So those are my thoughts on people not wearing masks during the coronavirus pandemic. Please put any opinions and thoughts in the comments section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be interesting. Thanks for watching.